Hi, my name is Keegan McTarian, and this is a presentation on HIV prophylaxis. According to the CDC, approximately 40,000 people are infected with HIV each year. This graph shows consistently high rates, around 82% in 2018, of male-to-male sexual contact transmission of HIV. This graph from the CDC shows the estimated prevalence of HIV categorized by race, ethnicity among men who have sex with men. Black African Americans have shown a consistently high risk, and the risk of Hispanic Latinos has increased dramatically over the past 8 years. This shows that these ethnic and racial populations are at a higher risk than white men for HIV transmission based on this data. Let's watch a short film on the CDC ending the HIV epidemic.
Many people assume that the HIV epidemic has been solved. There's not the same amount of attention to the crisis that there once was.
And that's a problem. The epidemic is not gone. We still have a lot of work to do.
You can't end this epidemic if we don't address social issues and the injustices that may be prevailing.
It's the ability to influence legislation, whether it's healthcare, affordability of prescription medications.
Making sure that everyone, regardless of background and ethnicity, has access to the resources that they need.
Supporting them by increasing their knowledge, awareness, and understanding, not only about sex education, but also about every resource they have at their disposal to ensure that they are healthy, happy, and whole. The goal is not to get people to shift and to become something they're not, but to understand the importance of embedding a focus on ending the HIV epidemic and supporting individuals who are thriving with HIV at the same time.
We're looking forward to the day that everyone is healthy. And our goal towards doing that is to increase the number of people that are aware.
We can amplify our reach and create echo chambers where meaningful messages reach people who otherwise might not have access to us in real time by leveraging technology and digital platforms to enable the work.
To help continue to inform people, inspire people to get tested, to get into treatment. In the millions of people that we can reach, I think it's possible.
A sexual history is recommended for all adolescent and adult patients. This is the first step to identify sexual behaviors and risks for HIV. Many providers defer the sexual history because of provider discomfort, urgent care issues, or anticipated patient discomfort. The following strategies regarding sexual history are provided by the CDC. Providers should assess their own comfort with discussing sex with patients and identify any possible biases. Providers need to be comfortable discussing sex in order for patients to feel that they can open up about their sexual behaviors. A rapport should be established prior to asking any sensitive questions. The use of neutral and inclusive terms, such as partner, should be used, as well as posing questions in a non-judgmental manner. One should avoid assumptions based on a patient's age, appearance, and marital status. Providers should pay attention to their body language and posture. Briefly explain why a question is being asked of a patient so that the patient does not get offended or be reluctant to answer. If a provider is unsure of a term a patient uses, ask for an explanation. Ask transgender patients for the correct pronouns or terminology. Using a transition into sensitive questions will help the flow of conversation. If someone else is in the room, ask them to step out for patients to feel comfortable answering these questions. Let the patient know that these are questions that you ask everyone. A recommended transition from the CDC is, quote, I'm going to ask you a few questions about your sexual health. Since sexual health is very important to your overall health, I ask all of my patients these questions, end quote. The Denver HIV risk tool was developed to provide a categorical risk for HIV based on 5 risk variables. The tool has been validated to group patients into risk classifications to identify those who are at an increased risk for having an undiagnosed HIV infection. This tool can also be helpful to providers to identify those who are at the highest risk of HIV infection and therefore could discuss the option of PrEP. There are 2 types of HIV prophylaxis. There's pre-exposure prophylaxis and there's post-exposure prophylaxis. HIV PrEP is taken by HIV-negative individuals prior to possible exposure to prevent the transmission of HIV. There are currently 2 approved medications for the use of PrEP in the United States. These 2 medications are the brand name Truvada and the brand name Descovy. The generic name of Truvada is also commonly known as its abbreviation TDF/FTC. According to the Centers for Disease Control and Prevention, CDC, clinical practice guidelines that were last updated in 2017, the only recommended medication that should be prescribed for PrEP based on its proven safety and efficacy is Truvada. This presentation will focus on Truvada. Truvada for PrEP has been found to be extremely effective, about 90%, at reducing HIV transmission when taken as prescribed. PrEP is indicated for men who have sex with men that are at risk for HIV acquisition. PrEP can also be indicated for a man who has sex with both men and women, someone who infrequently uses condoms during sex with one or more partners of unknown HIV status, who are known to be at risk for HIV, is in an ongoing sexual relationship with an HIV-positive partner, or history of bacterial sexual transmitted infections in the past 6 months. HIV testing, as well as the documentation of the results, is required to confirm the patient does not have HIV at the time of initiating PrEP. An antigen antibody test, antibody only, or rapid point-of-care FDA-approved finger-stick blood tests are acceptable HIV testing. Oral fluid rapid testing should not be used to screen for HIV when considering PrEP. Renal function and hepatitis B status should be resulted prior to initiating PrEP. An estimated creatinine clearance of less than 60 milliliters per minute is a contraindication to Truvada. Hepatitis B infection is not a contraindication for PrEP, but it could decrease a person's renal function. Vaccination against hepatitis B should be encouraged for all adults and adolescents, especially men who have sex with men. Screening for syphilis, hepatitis C, gonorrhea, and chlamydia are also recommended at screening. If prescribing to a female or born female patient, a pregnancy test should also be ordered. This chart is helpful in determining hepatitis B test results. Truvada is prescribed in its generic fashion of TDF/FTC, and the dosage is 300 milligrams/200 milligrams given once a day. The time from initiation of PrEP to maximum protection against HIV is still unknown. Preliminary data suggests that maximum concentrations are noted in the blood approximately 20 days after taking Truvada daily. Side effects are uncommon and most resolve in the first month of taking Truvada. Some common side effects include headache, weight loss, abdomen pain, nausea, and flatulence. Drug interactions include other antiviral medications that are listed here, as well as aminoglycosides, high-dose or multiple NSAIDs, or other drugs that decrease the renal function. These interactions can cause renal toxicities and should be monitored. Another consideration should be the use of the brand name medication Harvoni, which is used to treat hepatitis C. Truvada and Harvoni can cause drug toxicities when taken together. Patients who are taking PrEP should be assessed for active HIV infection. Providers need to perform a history of signs or symptoms of active infection during the first month of PrEP with a negative or indeterminate result of an HIV test. These symptoms include fever, fatigue, myalgia, skin rash, headache, pharyngitis, cervical adenopathy, arthralgia, night sweats, and diarrhea. For follow-up care, every 3 months, an HIV, pregnancy test, and STI testing for those at risk for recurrent STIs, such as those with syphilis, gonorrhea, or chlamydia at prior visits, or those with multiple sexual partners, should be completed. Signs and symptoms of active HIV infection and assessing for side effects, adherence, and HIV risk behaviors should be completed as well. A refill of the prescription for Truvada should be given, but not for more than 90 days. Every 6 months, an estimated creatinine clearance, syphilis, gonorrhea, and chlamydia test should be obtained. There are multiple reasons a patient may decide to discontinue PrEP. These can include personal choice, changed life situations that make them less at risk for HIV, intolerable toxicities, chronic non-adherence, or acquisition of HIV infection. Patients should be aware that their protection against HIV will wane after 7 to 10 days once they stop Truvada. Patients should be instructed to use alternative protective measures such as condoms to reduce HIV. Providers should document HIV status, reason for discontinuation, and recent medication adherence along with sexual behaviors during a discontinuation of PrEP visit. Payment assistance with Truvada is as easy as going to the manufacturer's website, Gilead. If you go to the link below, you can either get to the coupon code there, or you can also call 1-800-226-2056 Monday through Friday, 9 a.m. to 8 p.m. Eastern Standard Time to speak to somebody to help with the payment of Truvada. Let's review HIV PrEP. HIV PrEP prevents HIV prior to possible exposure. It is for those at risk for HIV, such as men who have sex with men or men who have sex with men and women, multiple sexual partners without consistent condom use, sexual relationship with an HIV-positive partner, and recent sexually transmitted infections. You must have a negative HIV test and renal function results prior to initiating PrEP. The treatment of PrEP is Truvada 1 tab once a day. This is free with a coupon code through the manufacturer's website. There are minimal side effects to Truvada. Most of those do resolve in the first month of treatment. Follow-up is every 3 months for repeat HIV, renal function, and STI testing. You must stress the importance of compliance due to the risk of resistant HIV strains with non-adherence when taking PrEP. Let's watch a short film on HIV PrEP.
Preventing HIV and having safe and healthy relationships are an important part of sexual health. We'll take you through an overview of PrEP with PrEP 101, show you how to access PrEP, and let you find out if PrEP is right for you. PrEP is an HIV prevention option that works by taking one pill every day. PrEP stands for Pre-Exposure Prophylaxis. When taken every day, PrEP can provide a high level of protection against HIV and is even more effective when it is combined with condoms and other prevention tools. People who use PrEP should take the medicine every day and return to their healthcare provider every 3 months for follow-up and prescription refills. Now, let's take a look at the numbers. In several studies of PrEP, the risk of getting HIV infection was up to 92% lower for those who took the medicines consistently than for those who didn't take the pill. Some people in clinical studies of PrEP had early side effects such as upset stomach, loss of appetite, or mild headache, but these were all mild and usually went away in the first month. How do you start PrEP? Talk with your doctor or healthcare provider. If you and your provider agree that PrEP might help, get tested for HIV and other sexually transmitted diseases, and to see if your kidneys are working well. If PrEP is a good option for you, your provider will give you a prescription. PrEP is covered by most insurance programs. If you don't have insurance, your healthcare provider can direct you to medication assistance programs that may help pay for PrEP. You can also contact your local health department and HIV and AIDS service organizations for more information. Thinking about PrEP to prevent HIV? Here's what to do next. Make a list of why you think PrEP would be right for you, and do your research and seek out information to help you decide. Also, think about your routine and what might make it easy or hard to take a daily pill. And always know you can call your healthcare provider if you have more questions. But what are the best questions to ask? Would PrEP be a good option for me? How much would PrEP lower my risk of HIV infection? What else can I do to lower my risk of HIV infection? Can I get help paying for PrEP? Are there any side effects to PrEP? How often will I be tested for HIV and other STDs? Will you prescribe and manage PrEP for me? If you decide PrEP is right for you, definitely take your pill every day. Follow your healthcare provider's advice about how to take your pill. This will give it the best chance to prevent HIV infection. Tell your healthcare provider if you have trouble remembering to take your pill or want to stop PrEP. Remember, you are in control. Get informed. Make the right choice for you. Check out the Start Talking, Stop HIV website for resources.
Let's move on to post-exposure prophylaxis, also known as PEP. Post-exposure prophylaxis is to prevent HIV in a person who is at a high-risk exposure to HIV. A high-risk exposure consists of a sexual encounter with someone who has or might have HIV or sharing needles injection equipment. HIV establishes infection very quickly. Therefore, you must start PEP within 72 hours after a potential exposure. HIV status needs to be determined, but do not delay initiation of PEP based on HIV status. PEP has been found to reduce the incidence of HIV transmission by 81%. The laboratory tests that you need to complete when you are prescribing PEP include a rapid HIV test prior to initiating PEP, if possible, otherwise HIV testing. As mentioned prior, if a rapid HIV test is unavailable, do not delay PEP. PEP can be discontinued later if the person already has HIV. You also need a pregnancy test, serum liver enzyme testing, a BUN and creatinine, which is the renal function testing, STI screening, hepatitis B testing, including the surface antigen, surface antibody, and core antibody testing, and hepatitis C antibody. Prescribing PEP. The preferred treatment is Truvada once a day with either raltegravir 400 milligrams twice a day or dolutegravir 50 milligrams once a day for 28 days for patients who have normal renal function. Side effects include headache and insomnia for raltegravir and dolutegravir, and nausea, fatigue, and severe skin and hypersensitivity reactions for raltegravir. Payment assistance for the other two medications, though you only need to use one when prescribing PEP, is as easy as going to their manufacturer's website. For help with the payment of raltegravir, you would go to Merck's website, and with help with dolutegravir, you would go to Vive Connect's website to get the coupon codes to decrease the cost of out-of-pocket for these patients. Patients who are on PEP are only going to be on the medications for 28 days. So the follow-up care is going to be focused on laboratory testing for possible new infections, such as HIV, hepatitis B, hepatitis C, syphilis, gonorrhea, chlamydia. And this is a nice table that shows when you should be evaluating these patients post possible exposure. So for example, with HIV, you're going to get a baseline test when you start PEP. 4 to 6 weeks after that possible exposure, you're going to recheck that HIV. You're also going to recheck it 3 months and 6 months after that possible exposure. For hepatitis B, you're going to look at the surface antigen, surface antibody, and core antibody to see if they already have had either a previous hepatitis B infection or have hepatitis B vaccination that would protect them. So you're going to check that at baseline and also 6 months after the possible exposure. For the hepatitis C antibody testing, you're going to check that at baseline and again at 6 months after the possible exposure. For syphilis, you're going to check that at baseline, 4 to 6 weeks after exposure, and 6 months after exposure. And then gonorrhea and chlamydia, you're going to check at baseline and 4 to 6 weeks after exposure. You're also going to want to evaluate for pregnancy in patients who are in childbearing years. You're going to check that at baseline and 4 to 6 weeks after possible exposure. As far as lab testing, because you are taking these medications for a short period of time, not only are you going to want to get the creatinine and liver enzymes checked at baseline, but you're also going to check them at 4 to 6 weeks after exposure. So let's review PEP. PEP is to prevent HIV after a possible exposure. It is for those who are at a high risk for HIV, such as those who had a sexual encounter without protection with someone who has or might have HIV, or sharing needles, injection equipment. It must be started within 72 hours of that possible exposure. Do not wait for a negative HIV test and lab results to start PEP. The treatment for PEP is Truvada 1 tab once a day and either raltegravir 400 milligrams twice a day or dolutegravir 50 milligrams once a day for 28 days for patients with normal renal function. These medications are typically free with coupon codes through the manufacturer's website. There are minimal side effects, and the follow-up care is repeat HIV, renal function, and STI testing, as well as a pregnancy test. This is a short video comparing PrEP and PEP. Let's go through a case study. Joe presents to the office with a chief complaint of screening for sexually transmitted infections. Joe is a 34-year-old Black male who reports he has intercourse with men. Joe denies symptoms and has never been screened for STIs before. What is Joe's Denver HIV risk score? What information should you gather on Joe regarding his sexual health? What tests should be ordered for Joe? What patient education should be presented to Joe? And would Joe be a good candidate for HIV PrEP? So let's start with Joe's HIV risk score. Because he is a male and his age is in the bracket that is at a higher risk for HIV, and because of his ethnicity and never being screened for STIs before, his score is 54. 54 is at a very high risk for HIV. What information would you gather on Joe's sexual health? Well, we would want to know, is he consistent with condom use when he is having intercourse? The other question that we would want to ask him is, does he have one sexual partner or multiple sexual partners? Is he in a monogamous relationship? Is he not in a monogamous relationship? What tests would be ordered for Joe? Because he's never been screened for STIs before, we would want to do a full workup on him. So therefore, we would want to get an HIV, hepatitis B, hepatitis C, gonorrhea, chlamydia, and syphilis testing on Joe. As far as what patient education would be presented to Joe, one thing we would definitely want to discuss with him is consistent condom use with all sexual encounters. And we could also discuss with him, because of his high risk for HIV, based on his Denver HIV risk score, has he ever heard of HIV PrEP, or has he ever considered being on HIV PrEP? And as far as would Joe be a good candidate for HIV PrEP, based on his risk, he is definitely a good candidate for HIV PrEP. The big thing that we would want to discuss with Joe is compliance. If he were to initiate PrEP, is that he would need to be on this medication daily, remember to take it religiously, and he would have to follow up every 3 months to have his renal function checked and HIV to ensure that we're not missing an HIV infection. Let's check your knowledge on PEP. What is the treatment for PEP? Select all that apply. A, Truvada once a day. B, Truvada once a day and raltegravir 400 milligrams twice a day. C, Truvada once a day with dolutegravir 50 milligrams once a day. D, Truvada once a day, raltegravir 400 milligrams twice a day, and dolutegravir 50 milligrams once a day. And E, Truvada once a day, and raltegravir 400 milligrams once a day. The correct answers would be B and C. How often does someone need to follow up while taking Truvada for PrEP? A, every 2 weeks. B, once a month. C, every 2 months. Or D, every 3 months. The correct answer is D, every 3 months. That concludes my presentation on HIV prophylaxis. These are my references. Thank you for taking the time to view this presentation. I hope it was helpful.